everybody, this is Lucy Fuller. I'm a veterinarian at the Charleston Animal Society, and today we're going to discuss history taking, physical exam, recording, and record keeping. This is just general medical records information, really important for the shelter technician or animal care technician to understand. So taking a complete history is super important, not only because we want to be sure that we understand the history, but also because it might be really important in making a diagnosis in an animal that's sick. Might be important in understanding whether or not an animal could be adopted, or if it needs, further medical care. It might be really important for you to know if the history so that you can decide if you need to involve a veterinarian immediately when an animal is taken in or comes to the shelter. We'll need to know the history potentially to know if the animal is safe. If surgery is a safe option, sterilization surgery. And failure to take a complete history might lead to a delayed or misdiagnosis. So it may mean a longer stay in the shelter for an animal, or even potential serious health complications. So history is pretty important. And it's not because we don't always know the history of a sheltered animal. Sometimes when I say history, I mean history of the animal's behavior, habits, all the things that have happened, symptoms since it's been in the shelter. So history may just be, within the last 24 hours. History may be the last 10 years if the animal is turned in by an owner. It's really a variable thing, but in general, it's important to know as much as you can about the animal if possible. So physical exam is an important part of medical record as well. A thorough physical exam is really a key component to any medical evaluation, whether you're doing it, whether it's a veterinarian doing it, or a technician's doing it, or an assistant. The exam should be systematic, meaning you go, and in general, we like people to go by systems as well, which we'll discuss in a minute. The exam should be complete, shouldn't be leaving things off. And if you have to leave things off, then you should be noting that you had to leave them off. And it should be objective. So we're not looking for anyone to try and make a diagnosis from a physical exam, unless they're a veterinarian. We're looking just for data collection. For veterinarians, often a physical exam, what is included in a physical exam is defined by law. So in South Carolina, which is where I am, it's defined by the Department of Labor Licensing and Regulation. But in your state, it may be different. So the physical exam should be fully documented in the medical record. You don't just want to put healthy. You should have the whole physical exam. Record keeping. Just in general, record keeping is extremely important. It's important that it be factual and complete, and it should be timely. So if you've gathered a bunch of information and written it on a sticky note somewhere and didn't put it on the record, sticky note gets lost. There's no indication that any of that was done, and so if someone were to come along later and look at the medical record, that it has no indication of what you had done, and it was assumed that it had not been completed. So I like to tell my staff, if it's not written down, it didn't happen. And by written down, I mean in the medical record. So this is a great example of a way to kind of capture a physical exam. I know a lot of us are pushed for time in the regular veterinary world and in the shelter world, depending on where you work. So having a checklist for a physical exam so that you can just make sure you've got, and you don't have to be a veterinarian to use this. You can do this at the intake area as well. Just do that physical, and if you've noted anything abnormal, then you show that to the veterinarian so they can take a look as well. Or the veterinarian, they collect this data and then have someone else enter it for them. This is just an example. This is off the AHA website, American Animal Hospital Association website, but there are lots of physical exam checklists out there that are available. So really quickly, a few terms that are important to understand. You may see these in medical records. You may need to use them. So vomiting, also called emesis, most of us just call it vomiting, is an actual forceful ejection of stomach contents through the esophagus and the mouth. So you actually hear the heaving noises. You see them pushing, the abdomen heaving or pushing. A lot of times dogs and cats will drool or lick their lips. Regurgitation is also an expulsion of contents from the esophagus or the stomach, but it's not forceful. So often it happens when the esophagus is dilated and the contents of that were meant for the stomach are just sitting in the esophagus. So there's no actual like muscle push to send it out. Usually it's like a silent thing, and all of a sudden there's stuff on the floor. Those are important. It's important to make the distinction between those two, because pretty much always people think the animal's vomiting. And often they are. But if you are watching them and you're not hearing them heave or hearing them make that noise, and it's not a forceful ejection, it could be regurgitation. So it's important to make that distinction. Signalment is another word veterinarians like to use. And signalment just means the animal's age, breed, the sex or gender. Really it's sex, I guess. Whether or not the animal is spayed or neutered. TPR is another term, and that's an acronym that stands for temperature, pulse, and respiration. We're going to talk about how to take a TPR because that's a really important part of a medical exam. It's important to understand how to do that, but you may see those terms and wonder what they mean. So there you go. All right, we're going to talk about how to get a history compiled or put together first. So gathering information, depending on who you're talking to, and really this is the same whether you're talking to someone who's a true client, maybe a foster, maybe someone who's turning an animal in. If you're working in a shelter, it's really depending. You're going to gather information with openness questions. And that's important. So you're not going to say, is your animal eating? A better way to say something would be, have you noticed a change in water or food consumption? Tell me how much they're eating. What is your animal eating? Because if you say, is your animal eating, they may say yes, but they may actually mean, yes, the animal's eating, but, a tablespoon of food a day. You're also going to ask signalment questions. How old is the animal? How long have you had it? Sometimes people don't understand the distinction between those two. Sometimes they've had it for 9 years, so they say it's 9 years old. Well, maybe it was an adult when they got it. Maybe it wasn't. So it's an important thing to ask. What breed are they calling it? Sometimes that's important. Is the animal spayed or neutered? Because it may not always be clear. Not everyone tattoos animals. And so especially if they're older, they're going to be a tattoo to indicate spayed or neutered. And the client or the person turning the animal in or bringing the animal in for a checkup may not know that answer, but it's definitely worth asking. So it's important overall to be systematic. Typically we like folks to have, I like my staff to have a list of questions that they go through in the same order for every animal. So there are lots and lots of different ways to do this, and it's really best to have your questions written down and kind of memorize the order. You may want to think about coughing and sneezing together. So you would say, tell me about the eating. Has the animal been coughing or sneezing recently? And then you would note down, like I said, has the animal been vomiting or regurgitating, having diarrhea or soft stool? Having no trouble defecating? Have they been vocalizing when they try to defecate? Anything weird like that? And then you move down to things like whether or not there have been changes in their household. So are they feeding any food? Do they have new pets, new people living there? Anything that could have caused the symptoms? Does the animal go outside? Yes or no? How often or how much? They go outside all the time. And then sometimes it's important, depending on who you're talking to know what was it about today that made you come in. So, say the animal's been not eating very well for a week, why did you bring him in today? And you don't have to, I'm not saying to be accusatory, more just, was there anything special about today that made you come in, or was it just one that was most convenient? Okay, so for the shelter environment, if it's an animal that's housed in the shelter and you're speaking to a staff member about it, trying to gather information, the staff member is kind of like the client. So you think of them in that way. So you may be talking to a kennel staff member or someone working, even a volunteer maybe, if that's who takes care of your animal. So ask them the question just like you would a client. Is the animal eating, drinking, vomiting, having diarrhea, straining to urinate, straining to defecate, vocalizing? Asking lethargic or differently than it was before? Any change in the kennel environment? Any difference in cage mate? Someone left or joined them that wasn't there before. Any change in food? If the food is consistent usually and now it's not. Any change in the feeding schedule? Was there a holiday, or some kennel techs feed twice a day and others maybe don't? Things that you're just not maybe aware of right off the bat. Any change in cleaning protocols, products, or anything like that? And then if there's a specific problem, like a limp or something, you may ask other questions about that directly. So like, for example, if the animal is limping, you may say, how long has it been limping? When did it start? Is the animal bearing any weight on the leg? So there are lots of different questions depending on the problem. And we've got some resources we're going to put in the Dropbox for everyone that have lists of questions. And we have some sheets that we use in-house that you may be interested in looking at that have questions specific for each type of problem, so that the person can go through. Either you as the staff member can ask them the questions of that person, the foster maybe, or the kennel staff member could answer them on a piece of paper. So you gather that information fully. So it's definitely worth considering having a standardized form for staff to fill out for history questions. Whether you fill it out when you're asking questions, or you have the staff member, as I mentioned, fill it out themselves. It's important to think about, because maybe you make sure that you get those questions answered. It also is a great form. You can retain it for a medical record. If you don't have electronic medical records, that's just your record right there. If you do have electronic medical records, you could potentially scan it in. You could get someone to type everything in. But you've got all the data collected. And before you present it to the veterinarian, in order to maximize their time and use it wisely, it's best to read over the form, see if there are any knowledge gaps that you can fill before they take a look at it. See if you need to collect some samples. We'll talk about that in just a minute. The physical exam is next. This is a picture of Dr. Bice, one of our veterinarians, examining this rabbit. Okay, so physical exam. As I mentioned before, it's important to be complete and systematic when you're doing anything, not just medical records, but the physical exam as well. You should gather what's called a minimum database, or a TPR. I've called it a TPR before. They're the same thing, really. Heart rate, respiratory rate, temperature. So if you've got a medical concern. Temperature, pulse, respiration. Potentially, you might want to gather some samples from problem areas. So if the kennel staff is reporting the animal shaking its head a lot, they think it has an ear infection, or it's got a foul smell coming from the ear, one of those things. You might want to get some swabs. And when we convene, we're going to watch videos and learn how to do swabs if that's not something you're familiar with. So don't be concerned about that. Maybe a urine sample. We'll talk about how to collect those. Potentially a fecal sample if the animal's having diarrhea or soft stool. All right, so this is just some pictures of collecting samples. And as I said, we'll discuss how to collect samples and how to analyze them when we all convene. So it's important to be objective when you're gathering all this information, whether it's the exam or the history. You want to get the facts if you can, or record what the owner says or the kennel staff says. So take a notepad along or a piece of paper. You're going to be able to keep track of what you gather, because you might forget. It's also a good addition to know your normal values and ranges. Maybe keep a reference with you. Of course, we all have our phones with us now, and so certainly you can have a note in your phone about normal values for heart rate and respiration rate. Here's an example. So if you're, for example, if you're looking at a dog the staff is worried about, and you take the heart rate and it's 250, that would be concerning. That would be something, as a veterinarian, I'd want to know pretty quickly. Because heart rate that high would indicate that the animal's having either a lot of pain or some other problem. Respiration rates typically for dogs between 18 and 24 respirations per minute. That does vary. Sometimes dogs will pant, and so it will be much faster, shallower breaths. Their temperature is typically between 99 and 102.5. If it's really far outside of those ranges, then that would be a concern as well. You might need to involve a veterinarian quickly. So it's good just to know what normal is. Same for cats. A cat with a heart rate of 250 is a little bit less concerning, especially if they're super scared. So it's great to know those normals. Generally, the larger an animal is, so a very large dog like a Great Dane is going to have a lower heart rate, generally, than a very small dog like a little Chihuahua. Same for cats, although the range is not quite as high with cats, given that they're intended to be close to the same size. So when you're gathering a TPR or a minimum database, you're going to need to touch the animal for the most part. So if you can't do that, then you need to make a note that you couldn't touch the animal, you just did a visual exam. You can often take respiration rate with just a visual exam because you can watch the chest rise and fall if they're fairly still. I prefer, personally, my staff take a rectal temperature if they're able to, because it's the most accurate temperature. There are other ways you can hook up those thermometers that go in the ear, and those are okay, but really a rectal temperature is the best. So you may need to have someone help you. And to take a rate, whether it's the heart rate or the respiration rate, you're going to count the number of beats that you hear or feel for 15 seconds, or see, and then multiply whatever number you get there by 4. That'll give you the number of beats per minute. Or if you're really bad at math, like me, I can't do mental math, I count for 6 seconds and then multiply by 10. But you get the picture. You're trying to figure out how many times their heart beats or they breathe in a minute. So some examples of how to check for these things. You can sculpt for a heart with a stethoscope, and it's a great thing to learn how to do if you don't already know. And we can go over that when we all convene in October. And you can practice with our stethoscopes and learn where best to listen. You can also feel in the inguinal areas, so the femoral pulse. That's a great place to feel. And even scared animals sometimes will let you touch up there. Not all of them, but it's not as invasive to some. You can also feel down on closer to their paws, but some animals really don't like that very much. So different ideas. There's a picture here of taking a rectal temperature. I would just like to point out that it's a great idea to wear gloves when you're doing this, because animals have parasites that we can get. But just remember, wear gloves, and then you can throw the gloves away. All right, so we're going to watch some videos. Not right now. We're going to watch videos when we all get together so that you can be reminded of how to do this physical exam and see it in action. And we're also going to watch videos of how to collect samples and then how to test them. So a urine sample or a sample from an ear, for example. Okay, record keeping. So the when, where, and what of record keeping, pretty much everything all the time. It's important for them, of course, as I mentioned, to be thorough, medical records, timely, and complete. Because often you're dealing with something that is legally required. Now, every state is different in this regard, but recently in South Carolina, shelters were removed from the list of exempted individuals, and so now we are required to keep medical records. Our particular shelter is already keeping medical records, but now it's required of all the shelters in our state, and many other states have the same requirements. So communication should be recorded as well, and so this is not just about medical records, but if you're communicating with a potential owner about ownership, that should be in the medical record. If you are gathering information about behavior, that should be in the medical record. Anytime you're indicating about a communication, the method of the communication should be noted. So, for example, if you have a phone call with someone and you gather some information about ownership or about the history of the animal or anything, then you should make a note that it was a phone call in your medical record and then what was communicated. It doesn't have to be verbatim. You should capture the spirit of the conversation and the basic salient points. And once again, if it's not in the record, it didn't happen. So some legal pitfalls to consider. If you fail, as I mentioned, if you fail to document or record something, you could have some legal challenges later. So if an owner does come forward and everything's not documented about how the animal was cared for, or if it was euthanized before they came to reclaim it, and you don't have documentation of why or what led to the euthanasia decision, then you could be dealing with a civil case pretty quickly. Once again, it's legally required for many veterinarians, and now, like I said, in some places, shelter staff to keep a medical record, so it might keep you from getting into trouble. And falsifying documents or purposely recording inaccurate information, of course, could also lead to legal problems, especially where drugs are involved. So if you're recording drugs for surgery or something, even if you're recording the drugs correctly, if you modified the medical records for something else and falsified it, then that could potentially come back to get you. You have to be very careful there. And then I like to mention, too, that breed identification, we all know that you can't necessarily tell what breed an animal is based on its physical appearance. There's some recent studies out of Florida that indicate that you only have about a 50% chance of correctly identifying the major breed of an animal, of a dog, just by looking at it. So really you have no better chance. You have a half and half chance of getting it right. However, if we are purposely mislabeling an animal that we feel pretty confident in many ways is a pit bull or pit bull type dog, Staffordshire Terrier, for the purposes of getting it adopted where it might not be legal to do so, then you may be setting yourself up for some issues if you're falsifying the medical records. Just things to consider. Hopefully that's not a problem for most people, but I know we all want to get them all adopted. Okay, so when you're recording information in a medical record, as I said, record everything. And it doesn't have to be verbatim, but you definitely need to capture all the important points. You should record outcome decisions. So if you've made a decision to euthanize an animal because it was very ill, then you should record why it's ill, or what made it ill, or what diagnosis you made, and then record that the decision was made to euthanize it. You should record the results of medical exams, tests, behavioral notes, as I mentioned, and then get them in there quickly and get them in there completely. All right, so we're going to do this activity when we convene. And I'm going to talk quickly about prescription labeling, because it's kind of an important part of record keeping. And we'll talk about this again when we all get together as well. All right, prescription labels. So this is an area that I see a lot of people making big mistakes. So prescription labels are super important to get right because you want the animal to get the medication in correctly, of course. And in many cases, it is also legally required to have certain things on the prescription label. So the medication, anything that leaves the building, so if you're in a shelter and you're giving medications in-house and you've got the prescription in the computer, if you use electronic medical records or attached to the paperwork, and you're just giving them pills daily, that's fine while they're in the shelter. If they get adopted or they leave with a foster, they need to have that medication in a labeled bottle. And anything that's prescribed by a veterinarian that leaves should have a label on it. So certain parts of what's on the label are mandated by law. Some of them are also common sense, I think. So what's mandated by law in our state include, and this may be different in every state, but it's usually pretty similar, medication type, so the name of the medication, the strength of it. So either the size of a tablet or capsule or the milligrams per mil of a liquid solution, and the total amount that you send. So if it's a 25 milligram tablet and you send 10 of them, you should have both, it's doxycycline 25 milligrams. Doesn't typically exist, but just for the sake of explaining. So doxycycline 25 milligrams, that would be on the label, and then it will also say 10 tablets. All right, so the dosage rate and frequency. So once again, with this fake drug, doxycycline 25 milligrams, we're going to give one tablet twice a day, and then you're going to have the total number of the total amount once again. So either the number of mils, so if you're sending a liquid medication home, you'd send home, you'd say 1 mil twice a day, and then it's going to go for 10 days. We're going to send 20 mils home, or 25 mils just so they have extra. Just make sure you put the total amount. Or you want to put the total number of pills, which I realize I spelled pills incorrectly. Sorry about that. The animal's name is important as well, and so if you're not using a number, a unique ID number to identify them, you should put a first and last name. So if it's a fostered animal, then I would use a unique ID number, either their animal ID number, we've used intake numbers here, microchip number would be okay. Don't just put foster one, because then there's no indication of who it's really for. If you're going to use a name, if it's an adopted animal, you can use the name that the animal had in the shelter and the owner's last name, as long as whatever you put on the bottle, someone could look at and identify which animal it's for, or you could look at the bottle later and say, okay, I can find this medical record quickly. That's the kind of name you need. The date is very important, of course. The clinic name, address, and contact number. So this might be your shelter on there. And often that's pre-printed on the label. That's not something, but you may have to type it every time. And the text initials or the text name who filled the medication, so that you can go back if there's a big problem and talk to the person who actually filled the medication. So it's an important lingo to understand. And this is unique to the veterinary world. Some of these abbreviations are not used in human pharmacy. So if you're calling or talking to someone in human pharmacy, they may have a different understanding of abbreviations like this. So it's important not to use abbreviations on the actual label. The veterinarian may use them on a prescription that's sent to a pharmacy to be filled, but often that's a little bit sticky because, like I said, the human world may use different abbreviations, but typically I find it best if you're writing a prescription or sending instructions to write it out. Don't use an abbreviation, but you may end up using abbreviations in the medical record to indicate what you did, and that's okay. So BID is twice a day, and that's pretty common. Every 12 hours is often how I write it. Because someone potentially could interpret twice a day to mean twice a day, but whenever I feel like it. And really you want them to be giving it every 12 hours. Morning and evening is another way to say it, but once again, someone may interpret morning differently than you. SID is typically understood as once a day. EID is 3 times a day. QID 4 times a day, and it's not very commonly used, but some people do use it. EOD is every other day. And then, so AU, A means oral, AURAL, and that refers to the ear. So AU means both ears. AS is left ear. The S stands for sinistra, which is Latin for left, apparently. And AD is right here. Once again, derived from Latin. OU, so O refers to the eyes. U means both. OU, OD for the right eye, OS for the left eye. If the instructions say to give something topically, that means you put it on the skin. Or that could also refer to the eye or the ear. But you should be clear if you're writing a medicine label and it says topically, you want it applied to a specific area. You should be clear not only about the part that's topical, but also about what part it should go on top of. PO means by mouth, that's for the Oz, once again Latin. And then the acronym PRN stands for per registered nurse. And what that means is that a medication should be used as needed. So sometimes you may see this on pain medication. So it may say up to 3 times a day or as needed, or PRN. Some other PRN medications might be eye medications for kittens. You know, if they're not having really bad problems, they may just be given a tube of medication to use when they're squinty. So when you're writing directions or typing directions, you should always, always, always include the route of administration. So you're going to say, even if you think it's obvious, you should always include the route of administration. So these cephalexin capsules are to be given orally. Because sometimes people just don't know. You should be complete and explicit. So explicit, I mean explain everything fully. And you should also check with the client or the foster or the adopter, whoever's taking the medication, before you send it out with them. So make sure they understand what you intend on the label. If you say, you know, this is to be given topically, and it's Animax or something like that for gooey skin, you know, this is where you put it on this spot right here, and you're not going to give it orally. Okay, so this is a good time for you to sit and practice writing prescription labels. And we can do this again when we convene, but just good practice. This may be something you're familiar with. You may type labels. We have a program, as I'm a label maker, and we have a lot of pre-written labels, so the staff has areas they just fill in, and that may work really well for your shelter. Or you may have to handwrite everything. We used to handwrite everything here too. So I'll just go through these. You can follow along and practice, and then we'll practice these again later. So example number 1, your veterinarian directs you to fill a prescription for Clavimox drops, 1 ml PO BID for 10 days. And you're going to mix that medication before sending it out. So you know anything about Clavimox, you'll know that it comes dried and you have to reconstitute it. You can send it out and have instructions for the user to reconstitute it, but that means you're going to have a much longer label. And often, folks get really intimidated by having to mix medications on their own. So usually you'll mix it before you send it out. All right. So this is a picture of this label for this particular medication. We've just typed it up on our label maker. And so we have, at the top here, you'll see we have the veterinarian's names listed. We have our address and our phone number. We have the name of our facility. Excuse me. And then you're going to see the patient name under that. It's a cat, Funky. She did exist. And she's getting that Clavimox, those Clavimox drops. And so Clavimox drops, if you look on the box, you'll see they're 62.5 milligrams per ml. So you just look right on the box and it'll tell you what that concentration is. So that needs to be on there. The quantity, and once again, this is on the box, is 15 mils. And then the directions, so my directions said 1 ml PO BID, but you're not going to say that to the client or the adopter. You're going to write it out. You're going to say give 1 ml by mouth. You can say orally too, twice daily for 10 days. Now, even better here would be every 12 hours for 10 days. Give with a meal is what we recommend for Clavimox. And then you'll see at the bottom, it's kind of overlaid over this red. You'll see that there's the date. And then we also are putting the expiration date, which you can get from the box. What's missing from this label, because I'm the one who printed it, who didn't do it, is the initials of the person filling it. So my initials should be on there. Okay, here's another example. So that directs you to fill a prescription for doxycycline, 150 milligrams, POVID for 10 days. All right. And so we have tablets here at our shelter, 150 milligrams tablets. All right, for this particular medication, you'll see a very similar setup. This is for funky. We would be getting a huge overdose of doxycycline if we actually did this much. So we've got the name of the drug, and then 150 milligrams is the size of the tablet. The quantity that we're sending there is 20 tablets. And then the directions, once again, very similar. 1 tablet by mouth twice daily for 10 days. Give with a meal. We also recommend giving doxy with a meal. And then you see the date and the expiration date. And once again, the initials are missing. Okay. One more here. So the vet directs you to fill a prescription for Animax, 1 drop AS, BID for 7 days. So, talking about different body parts here. Okay, so Funky again, she's getting this Animax ointment. Now, it doesn't have a listed concentration on here, and that's okay. I'm just putting what the product is. It's a labeled product, but we are putting the total quantity, so the size of the container. And so the directions here are important. Apply a small amount to the left ear, because it said OS, so that means, or AS, I'm sorry. That means the left ear. And we're going to do that to that ear canal twice daily for 7 days. All right. So if it said AU, you would have said apply a small amount to both ears canals twice daily for 7 days, and then the date and the expiration date. Okay, so just another example of what should be labeled. Any medication dispensed from the facility for a particular animal should bear a label, so whether it's Chlorhex wipes for yucky skin, whether it's a special ear medication to clean the ears out, whether it's heart guard or some other heartworm prevention, they should all have labels. Those are all prescription medications. Don't forget that you might want to add some special precautions. Certain types of drugs or things that you send out may require you to wear gloves, or maybe a good idea to wear gloves. Some things may need to be kept refrigerated, like Clavamont. You should be sending meds home in a child-proof container, or if they're not in a child-proof container, you should get one of those little stickers that says container not child-proof, because you never know who might get upset or have a problem and then want to sue you because you didn't label something that's not child-proof. It's always a good idea to have someone double-check the prescription, the label, and the medication itself, and that person should initial the label too. So it's a great practice to have the vet do it if you can. Otherwise, you could have someone that you trust who's got a lot of experience to do it, just to make sure you didn't make a mistake. And then you should always offer to show the client or the adopter or whoever you're dealing with how to use the medication. Give the first dose, walk them through it. That way you know that they know how to do it. And that way if they're going to have a problem giving it after seeing you do it, then they'll know that before they leave. So you should check your drop box for the foster recheck form, which is a form that we use for fosters when they drop off to gather a history. And then we've also got something I mentioned earlier called a quick guide to history taking, and it has a great list of questions that you can use for your staff. Just a great outline of different questions to ask, and it kind of goes through by body system. Okay, thanks for joining me today, and I look forward to talking about this again when we all convene.